I'm sure you're probably already used to, right, with how busy it's been.
We've been fielding a lot of questions as well for NBC News on Facebook and Twitter.
Awesome. So now we're answering your questions here live today. And guys, I want to be sure that you are aware. We will take them live from wherever you're commenting, whether that be Facebook, Twitter. Just make sure that you comment below and we will get to those. So let's just dive in. We want to talk about travel, right? New York City, we are a commuter city and people want to know, first up, can they travel abroad? Aside from traveling within the city, but also abroad.
Yeah, this is a big question on everyone's minds because spring break is right around the corner and people want to know, should I go to that wedding? Should I go to that convention? Should I go on that trip? Right now, the CDC guidelines are if you are 60 or above and you have any sort of underlying health condition, what does that mean? A lung condition, a heart condition, if your immune system is compromised in any way, the CDC is taking a pretty extreme stance on this and they are saying, don't travel. Avoid big crowds, limit any non-essential travel. It's just not worth it because it's not that you're at a higher risk of catching the COVID-19 virus. It's that if you catch it, you're at a much higher risk of developing complications because you already have a compromised immune system. So that's the recommendation. Now, if you're healthy, if you have children, if you have a trip planned coming up, this is where your personal risk meter has to go off. How much risk are you willing to take? Where are you traveling? Are you going into an area where there is a known outbreak? What are you planning to do? We have a trip coming up to California where my parents are supposed to take our 3 girls to visit their other grandparents in California.
Right.
I'm just going to watch and see as we get closer. But if they vigorously wash their hands and they don't touch their faces and they exercise those safety precautions, I think we'll say go for it.
Right, so go for it. For those who do want to go for it, right? You're going to California. Where are you paying attention, or where are you looking to find out if it is, if it is safe? CDC.gov is a great resource that is constantly being updated, constantly changing. We have so much information on NBCnews.com as well. We have a live blog that's posting all the information that's coming in from the World Health Organization, from the CDC, from the various states as we learn more about how this virus is spreading and what's developing. And some of the news is good. As we are learning more, we're learning that kids are not seeming to be as affected. They're having milder symptoms. So not all of the news is bad or scary. It's just about staying on top of it and understanding, okay, what is my risk at any given time, considering the activities that I'm doing and my own personal health. Right. So speaking of staying on top of it, for those who maybe still want to go on those trips, right? We got a question about that. I still want to go. What should I do? What should they know to do?
So important, and I know that people are sick of hearing this, but really the golden rule when any kind of cold or virus or flu season is upon us is wash your hands frequently with soap and water. Warm water is preferable, hot water is the best, and do it for 20 seconds. And the World Health Organization has a great video about how to do it properly. So it's this normal thing that we're used to. Then it's this, and then it's this, and then it's like around your thumbs.
Downward, right?
Then it's this, and then it's really swirling your fingertips and your fingertips in both directions and then rinsing. The good thing about that is it really does take about 20 seconds. So you don't have to just sit there and sing the happy birthday song twice or whatever. You're so busy focusing on your technique that 20 seconds will go by. The other key is don't touch your face. That is so hard to do. I do it all, like you're moving your hair around or whatever, and you don't know, it's unconscious, but really try to keep those hands away from your face. This is not a disease or a virus that can get in through your skin. So you literally could have coronavirus on your fingers. If you don't touch your mouth, your nose, or your eyes, you won't get sick. So if you wash your hands every chance you get, you're going to be fine. And that helps with people who are freaking out that they don't have hand sanitizer or there are shortages of that. We didn't have hand sanitizer, just a few years ago. What did we do? We just washed our hands with soap and water. Still, that's the #1 piece of advice if you're traveling or whatever you're doing.
Awesome. So the same precautions we've been hearing, right, over the past few days of just in general, whether you're traveling or not, making sure you're washing your hands, not touching your face. And then, we've been hearing of planes being diverted, right, because people are just anxious about what's happening. So, in the midst of travel, what should people be aware of? I mean, is that just packing hand sanitizer, or
what should you be bringing?
Right.
So this is important too. If you are planning to travel and you have young children or you have any kind of conditions you're worried about, just bring some of those extra over-the-counter meds, cold and flu things, fever reducers, ibuprofen, Tylenol, pain relievers, because those are the things that could come in handy whatever kind of illness you get. Sometimes when you travel, your immune system gets a little depressed anyway, so you want to have things that will make you comfortable. Plenty of fluids for the kids and for yourself. Hydrate all the time. If you want to, you can take vitamin supplements, but it is about eating healthy and getting rest and trying to reduce your stress levels. All of those things are going to help boost your immune system as well.
Perfect, perfect. I hope y'all are taking notes, by the way, because we just gave you a rundown, right, for your travel go bag, just to make sure everything's good.
Super important.
And just a reminder, if you were just now tuning in, we are live answering your questions about the coronavirus, but specifically today about travel. And so we have NBC News correspondent for consumer and as well as investigations, Vicky Nguyen, and you are just breaking it down for us. So as well as with travel, right, commuting.
Yeah.
Again, I mentioned we're a big commuter city, right? Just this morning, I was, on the train downstairs.
Was it crowded?
It was not funny enough. I was like, I've never seen 49th and 50th Street, this sparse.
Yeah,
like,
yesterday one of our producers posted a photo about Times Square, and it was really not as busy and crowded as it usually is. I think people are getting the memo, and a lot of big companies, Amazon, IBM, Facebook, asking employees to work from home. So that's actually helping. They're also staggering work times. So, if you can come in a little later or if you can come in a little earlier, you might be able to avoid those rush hour crowds. And that's helpful. You just really don't want to be around people who are potentially sick, coughing or sneezing. Right. You're trying to keep that 3 to 6 foot distance, which is helpful because this is a virus that's carried in those respiratory droplets.
Right, right. And I'm sure maybe some of you who are watching right now, you're probably working from home, right? Yeah. If you are, comment, we want to know. So get an idea of who's watching, right? So next up, for people who are taking that risk, who aren't working from home, and they are, taking the train, the subway, what have you, can they get sick on mass transit? That's one of the questions we got. Can you get sick on mass transit?
Well, let me reiterate that people should be living their lives. This is not something that needs to keep you at home. You do not need to hunker down. No one's telling you that you are under quarantine. Go about your daily life and just think of it as a heightened awareness of doing the things we should all be doing during cold and flu season. If you're sitting next to someone on a train and they start coughing or sneezing, it might feel rude, but just get up and move away if you can, or try to scooch away, or literally try to hold your breath. You're really trying not to get those droplets because that's how this virus is spread. If you're touching handles on a bus or in a taxi or in a ride share, don't touch your face until you can get to your office and wash your hands. You're gonna be okay. As I said, it's not going to be transmitted through your skin. So yes, are you at an increased risk of getting some kind of illness if you're traveling with sick people? Sure, but is that enough to keep you from going out to stores or movies or restaurants or going to your job? No, you should not be worried about those things. Just practice good hygiene. Right. But if you are sick, stay home. This is not the time to be out in a crowd.
It's interesting. I wonder if any of our New Yorkers, noticed yesterday it was advised, right, to stay off of trains. And then you see people getting off work and then seeing how crowded it was, right? So I'm curious, maybe people saw, actually this isn't really possible here in New York to have that distance on those carts, right?
It's not. It's very difficult to do that in any kind of major metropolitan area. So just be smart about it. And really, it's trying to avoid sick people, not touching your face and washing your hands a lot.
Right, so we've been hearing a lot of debunkings, right, as far as wearing masks go.
Yeah, and we see a lot of masks out there.
We are, even still, right? It's so fun. Like, you hear constantly and constantly, only health workers, right, or people who are already sick should be wearing masks, but nevertheless, people are still wearing them. So should they?
Let's talk about masks. There's really 2 different kinds of masks that you are seeing out there. One is the surgical mask. That's the one you go to urgent care and there's a box and you just reach in and get one. That mask is for people who are sick. If they're sitting in urgent care or in the ER and coughing and sneezing, they're asked to put that mask on to trap their germs against themselves. It's not super airtight, and it's not meant to prevent you from getting coronavirus.
Got it.
The N95 or the N99 masks, those are the ones that the World Health Organization is asking and the CDC is asking to preserve for frontline healthcare workers. Those masks actually have to be specially fitted so that they don't let any particles in. Yes, they will prevent the coronavirus from getting into your respiratory system if they are worn properly. If you don't have either mask, it's okay. You're gonna be just fine. You don't need those masks. If you practice the other good hygiene habits we've talked about, not touching your face and washing your hands, you do not need a mask. Of course, avoid anyone who's coughing or sneezing. Try not to breathe in those respiratory droplets. And a mask can help with that. The same way like a turtleneck could help with that. But don't let that give you a false sense of security. Same thing goes for those surgical gloves or gloves.
Right.
Sure, you're not gonna be touching things with your skin, but if you touch something with a glove and then you touch your face, it's the same as if you didn't have a glove on at all.
Right.
So don't worry if you can't get those extra special things that you're seeing. You don't need them.
That's really good to hear. I remember we had a comment on Instagram just a few days ago, a bus driver saying, hey, I'm hearing only health workers should wear this, but what about me? I'm on these
They're
buses
exposed
every
to
day,
a lot
right?
of people. Absolutely. Somebody asked that about, I'm an Uber driver. Should I be wearing a mask? Worried about people coming in? If you have an N95 mask and you know how to properly wear it and fit it, it's not the most comfortable mask. You're going to be wanting to take it off every half hour
and
anyway.
You're touching it,
and you're touching it. So, you know, I'm not going to tell anyone not to do something, but I want people to not worry and not panic if they don't have access to those things, which most people don't have.
Right, right. So it looks like we have our first question. Our producer, Jesse Edwards, off camera, says, here we have Courtney, who is running the NYC half this weekend, and Courtney wants to know, should she avoid it? Should we be avoiding other big events in the city?
Courtney, first of all, that's awesome that you're running a half marathon.
Oh, girl.
If you're able to do that, that means you're pretty darn healthy. Your lungs are probably functioning fantastically. You've probably gotten into great shape for this. If you are not feeling sick, by all means, run the dang thing, get the medal, congratulate yourself, pat yourself on the back. I think that's fantastic. You don't have to avoid running the marathon. If it's still going on, go for it. But just try to stay away from people that may be coughing or sneezing. You know, try to keep your distance as best as you can. Get out there, get your run on. You're going to be okay.
I love that. Get your run on. It's true, though. We have been seeing a few events get canceled.
Sure.
You know, be it South by Southwest. So it's probably just making sure you're aware of, you know, the different festivals and events, making those precautions, right? And as we know so far, the marathon has not said anything. So.
Right.
Good. Well, good luck, Courtney.
Yes.
You got this, girl. All right, next up, we have another question from YouTube. And this person says, I traveled to New Rochelle. What should I do?
Okay.
I understand New Rochelle is one of the main hubs right now.
Yes, that's a major hotspot where a majority of the cases in New York are centered. The question for you, YouTube viewer, is how much contact did you have with folks there? Do you think you were exposed in any way to the cluster there? Because obviously there are thousands of people now that are under quarantine in Westchester County. Question number 2 will be, are you experiencing any symptoms? Do you feel sick? Do you have a fever, a dry cough, or shortness of breath? Those are the key symptoms for coronavirus. So if you have been exposed and you are experiencing symptoms, call your healthcare provider right away and ask them what they would like you to do. Odds are they will tell you either if you're young and if you're healthy, they may have you stay at home and self-treat. There's no cure for the coronavirus, but there are things you can do to take Tylenol to reduce a fever or pain meds just to reduce the aches and pain. You just have to kind of let this thing run its course. They may have you come in and take a test to see if you are positive, and then you'll know, and then you'll need to know what you need to do in a self-quarantine situation. So those are the 2 things you need to ask. What kind of exposure did you have? Do you have any symptoms? Call your doctor. And if it just makes you feel better and reduces your anxiety, call your doctor.
Perfect, perfect. And if you caught maybe just the tail end of that, that was someone who had traveled to New Rochelle and wants to know what they should do. And I think that's great advice.
It's great advice for anyone, not just New Rochelle, but if you've been to any area where there are known coronavirus outbreaks occurring.
Right.
That's what you need to do.
Awesome. So for those of us, right, we were talking earlier, Vicky and I, we were saying just how empty, right, parts of New York is looking, specifically right downstairs here at 30 Rock, right, 49th, 50th Street. I was walking there this morning and I'm like, where are the people? So that, to my mind, means people are working from home, right?
Yes.
A lot of people are working from home.
Travel is down too. Not as many tourists are going on the trips that they wanted to go on.
Right, I know. I'm like thinking about a trip I have coming up. But, you know, for those who maybe haven't had that conversation with their boss or aren't being advised to stay home, how do you have that conversation? How do you bring that up?
Thankfully right now, hopefully everybody's pretty woke about the coronavirus and it won't be that awkward. This is a great opportunity actually to bring it up. We were talking about this morning on the Today Show.
Right.
What are some of the things you need to do if you're gonna work from home? But I think this is going to maybe lead to a lot more companies realizing, you know, some of our folks can work from home and they're just as efficient, sometimes more efficient when they're at home. So I would just bring it in a very matter-of-fact way. If you have the luxury of having a job that can be done from home, we don't really.
Right.
You know, our law enforcement, they don't. Our bus drivers, they don't. But if you do a job where all you need is a laptop, a webcam, maybe access to a printer, it's a good time to say, hey, boss, with everything that's going on, would it be okay to try this out? Maybe not the whole next week, but maybe a couple of days. Right. You know, baby steps into it. See how it works. But have that frank conversation. And I think that what's in the news right now is going to make everyone more more accepting of it and ready to hear it.
Yes, exactly. So we have another question. This one comes from YouTube. Darren wants to know, what do I do if my flight gets canceled?
Okay, so if your flight is canceled, call your airline, talk to them about what your rights are. It's going to be not a one-size-fits-all situation just because different airlines have different policies, but if they're the ones canceling, you should be entitled to a refund. And you may actually even be able to negotiate because of what's happening with the travel industry right now. Maybe you can say, hey, can you give me a credit towards a future trip and also maybe a little bit of extra
Smart.
Which is nice because they're going to get your business anyway. You're going to stay with them. You're just not going to fly now. They're the ones that canceled on you. So you have rights as a consumer, absolutely, to get that money back.
Awesome. So speaking of flights, I have a trip coming up, and I'm wondering, like, what about insurance for trips, right? So maybe people who haven't booked yet, is there anything that, you know, people can do to kind of ensure that should my flight end up getting canceled, will I be okay? Will my pocket be okay?
So there's actually 2 points to this, Kay. This may be a great time to be booking summer travel. There are so many incentives right now. Hopper just sent out an email this morning talking about the great prices for round trip tickets from New York to, you know, even Vegas, Los Angeles.
So cheap right now.
Super cheap. Round trip,
crazy.
I think, was like for under $150 to LA. Other ones were in the double digits. So if you can, maybe now is the time to snag that travel. Use the savings, part of it, to invest in cancel for any reason travel insurance. So that's CFAR, cancel for any reason. That's the little acronym for it. It costs a little bit more, but then it gives you some peace of mind so that if this thing is still at this level in the summer and you don't want to travel, you will get your money back.
Nice, nice. Okay, taking notes. Perfect. So next up, right, we understand, right, you have a background in consumer, and people here are looking to stock up, right? They want to get hand sanitizer. Where can they even find it? So for those who, you know, maybe they get self-quarantined or they want to quarantine themselves, right, work from home, what should they be stocking up on?
Yes, this is so important, and this really goes for any sort of crisis. We're taking guidance from the Department of Homeland Security. 2-week supply, which coincides with the 14-day quarantine period for coronavirus, but it's a good idea to have non-perishable foods and water on hand for 14 days. Not because we think the water supply is going to be contaminated, it's because you want to be self-sufficient in case there are any disruptions to the supply chain.
That's interesting.
And frozen foods are fine to mix it up because we don't anticipate power going out or anything, but you want shelf-stable foods that are going to be good for you and or your family. Next up, those over-the-counter medicines that you want to have on hand. I'm seeing a lot of those still on store shelves, so you're okay with that. The fever reducers, the pain relievers. And if you have kids at home, you know, Pedialyte, those liquids that contain electrolytes, those are super important as well. You want to stay hydrated. And then any other things that make you comfortable, you know, hygiene products, detergents, soaps. If you've got babies, you really want to make sure you've got your baby supplies. And our pets. Don't forget about our pets. Some of our pets need medicines. They obviously need food. Sometimes they need those little pads if they go to the bathroom inside. I mean, all of those things. Just think, if I could not leave my house for 2 weeks, I could not go to the store, what would I need to stay here? Visualize that plan. Write it out if you need to. And then talk to your friends and family to make sure they're prepared too. If you have elderly folks, neighbors, look out for them. Make sure that they have what they need.
Awesome. So I know you spoke a little bit about the non-perishable items, and I'm glad you talked on pets because I feel like I'm like not hearing much about that at all when it comes to advice and what things we should be getting
Our pets
for our
rely
little
on us.
babies.
Yeah.
So for non-perishables, I just want to make a quick note as you all are watching this. We actually have a list on NBCNewYork.com. Yeah, so you all can check that out. If you want to make that grocery trip, we have a breakdown of all the different non-perishable items you can get. So it looks like we have another question from many of you actually saying that they can't find hand sanitizer or toilet paper.
Wow.
What should they do?
Okay, so toilet paper, I remember being at Costco a couple weeks ago.
Yeah.
We just happened to be there first time visiting, and it was the weekend that everyone decided they were going to swarm Costco's across the country, and a lot of them did sell out of toilet paper.
Yeah.
Check again to see if, you know, some of these stores have resupplied, because that's something that most stores stock pretty frequently. So if they're out one day, odds are a couple days later they'll have toilet paper. Hand sanitizer is another story. Purell just announced today that they are greatly ramping up their production of hand sanitizer. And there have been some questions about, well, do I just make it myself? We've seen those recipes of
DIYs.
1 part alcohol to 2/3, like 1/3 alcohol to 2/3 aloe vera gel. The jury's a little bit mixed on that, right? If you blend it properly, will it work? Will it be too drying? Is it the same? Again, if you can't get hand sanitizer, that's a relatively new product out to the market. What we used to always rely on and what used to always work to protect us from germs and what will still work now is soap and water. Bar soap, liquid soap, whatever soap you can get your hands on, and nice warm water, a vigorous washing for 20 seconds, and don't touch your face. So you don't need hand sanitizer, especially if you're gonna be at home and you're going from home to work or something. Generally, you're gonna have access to a sink. So wash your hands the second you get home, wash your hands the second you get to work, wipe down your keyboards. A lot of offices do have supplies.
Yeah.
New York City, thankfully, is providing free hand sanitizer, not to individuals, but to agencies like MTA or to schools that service a lot of us. So that's great too.
We even just came up with our own, actually.
Yeah.
Not too long ago, the governor announced our own hand sanitizer.
Right.
So there's that. But again, if y'all missed that, right, that hand sanitizer note, that's if you can't find any.
Right.
If you can, of course, you know, and you're traveling, you want to pack it.
Beware of price gouging, because right now, hand sanitizer on some store shelves and online is going for exorbitant prices. Don't get sucked in. You do not need to waste your money on that. It's just not worth it. Just wash your hands frequently. Don't touch your face. You'll be fine.
Perfect. And if people are seeing price gouging, what should they do? What can they do?
Yeah, absolutely. They can report it, and they should report it, and there are consequences. We're seeing stores around New York City being shut down because of price gouging, trying to sell hand sanitizer for $50 for a little bottle. So you report it to your state's attorney general, or if it's online, you can call the online retailer. Like Amazon is doing its part to take down sellers that are trying to gouge people. So just report it to the retailer itself as well.
Amazing.
Or your city attorney also is someone you can call.
Awesome. So Vicky, I know you've been following this, right, for the past couple of weeks now. Anything else that, you know, our viewers should know, or where they can maybe continue to follow your own reporting?
Yeah, you know what? We have a Corona team that's active every day on today's show, and that's where we are really monitoring everything that's happening, because each day the news on this is developing and changing. We're getting new data. Right now, the mortality rates from coronavirus seem higher than the flu. They are higher than the flu, but when we get all of the numbers, it looks like that mortality rate is going to come down. I look at this as a very contagious illness, but it's not something that you need to worry about. You can prevent it, and you should prevent it, and you can do really basic things. And I think that's the hardest part for people to wrap their minds around, because we're talking so much about it. If flu kills more people than, you know, these types of viruses, why do we hear so much about this? It's because it's new. It's because no one is immune to it. There's no vaccine and there's no cure. So that's why there's so much interest. It's global. That's why we have to report on it. But at the end of the day, the very basic advice of washing your hands and not touching your face is going to serve you well.
Perfect, perfect. We'll be sure to keep our eyes out for that reporting as well. And thank you so much for joining us, NBC News' Vicky Nguyen, and you all for joining us as well and giving us your questions, which we will be sure to continue answering over these next few days, and more of which you can find on our website at NBCNewYork.com. And if you're on the go, you can just grab your phone and download the NBC News 4 app, where we'll be posting updates as well. So thank you so much.
Thanks for having me.
Thank you.